Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. So, we all know there's been no shortage of stories about the stress that the COVID-19 pandemic has put on the country and the economy and people's lives. But it's also spurred new ways of thinking across the healthcare industry about ways to deliver care, ways to be more efficient. And today I'm really pleased to be joined by Dr. Hal Paz. He's CEO of Ohio State Wexner Medical Center in Columbus, Ohio. We're going to talk about ways that health systems are actually driving innovation in the face of the worst pandemic of our lifetime. Hal, thanks for being with us today. We really appreciate it.
Thanks, Matt. I really appreciate the opportunity.
So let's touch on that topic of innovation. I know it's something you've spoken about quite a bit throughout the past year during the pandemic. At Wexner, you've done some innovative things, even early on, where you found new ways of sterilizing PPE. I think you also borrowed some 3D printers from your dental school to make swabs for testing. Talk to me a little bit just about your focus on innovation during the pandemic.
Yeah, certainly. When I came here 2 years ago from CVS Health, and prior to that, my entire career had been in academic medicine, academic healthcare. But when I came here from industry, my focus was on how do you create this transformation from a health system to a health platform. And we developed a strategic plan early on, working on ways to achieve that vision. Never in my wildest dreams did I ever imagine we would have this past year that would accelerate that move in ways that we're only beginning to understand today. And it cuts in a number of different directions. One is the use of data and analytics. Early on, when I arrived here, we created this analytics center where we brought together various parts of the medical center complex, the College of Medicine, and our James Cancer Hospital to create one analytics center for the whole campus. We thought that was extraordinarily important, and we've been able now to leverage analytics and to get more and more into predictive analytics to think about the steps that we need to take proactively to address this pandemic and how it's impacting this broad geographic community across Ohio. So that's really been one key innovation that I think has been extraordinarily important. Another is this move that everyone has talked about, certainly this move to digital and virtual care. I had been doing some of that work when I was at CVS Health Aetna, and when I got here, we were doing 50 telehealth visits a month. We now do roughly about 2,800 a day. But we're backing that up with analytics and data, and finally digital. And the digital apps and the digital approach is extraordinarily important, including things like Autobots, where you have AI embedded in our webpage to guide patients through the vaccination process, for example, to answer their questions in real time. AI is going to play a really important role going forward in this transformation. And then last but not least, more and more work about driving care into the home. How do we best do that? And again, that reflects some of the earlier work that I had an opportunity to participate in, recognizing that healthcare per se is an incredibly important determinant of health and well-being, including avoiding premature death. But we know there are multiple other determinants: social, behavioral, environmental, and genetic determinants of health. So as we acquire the data, then we can think about solutions beginning in the home and in the local community to leverage assets in those communities to really address social and behavioral determinants of health, and even more and more now, environmental determinants of health. We didn't think early on that it played a very big role. We talked about lead in the water or ozone in the air, but now with climate change and all those impacts as well, it's really giving us a holistic understanding of the impacts of these things, these determinants on premature death, and equally importantly, health and well-being for a very diverse community. And diversity and health equity is becoming a very important part of our overall strategy at the Ohio State Wexner Medical Center.
Yeah, and I do want to touch on the diversity and equity piece, but I want to close out first on some of this innovation and that thinking and the use of AI and data analytics. I mean, as you know, healthcare is pretty slow to adapt or adopt new things. How do you take what you've learned over the past year on the use of analytics and AI and care for patients at home, those types of things, study them, learn them, and figure out what the next 5 years looks like for those types of advances?
Yeah, so I think it's really important to use these technologies and to be nimble with them, quite frankly. I'll give you an example. Vaccinations. This week will probably approach 100,000 vaccinations at the Wexner Medical Center. We've had days where in a matter of hours, 2 hours, we could load 2,000 patients into the system. And we can get the patients through this super site that we've created on campus at the Schottenstein Center, where every 15 minutes we can vaccinate a patient, and we get them through in increments of 30 minutes. We're talking about thousands of patients that can get through the center in a given day. Our limitation is the amount of vaccine that we can get access to in a single day. We think that's incredibly important. We set up a sister site on the Near East Side. The Near East Side is a community that is largely underserved, largely minority, and we want to make sure that we give our minority populations here in the greater Columbus region access to the vaccine. Using data and analytics, we can identify where those patients are. We can use zip code data to then align the vaccination process with the patients who have this need. And it allows us to work in a much more granular level in the local community, with community organizations, with churches, with community leaders, to build trust so that we can address vaccine hesitancy as well. And it's been gratifying to see the uptake in our ability to have that impact in the local community. Without having access to this kind of information, it is incredibly difficult to be able to move these things in such a short period of time. And another example is COVID testing. We've done over 500,000 COVID tests to date. The first week of the pandemic, we were doing roughly 40 a day. We quickly created a platform where we could do 4,000 a day. And I think really that speaks to the power of innovation, and how, if we're data driven against this kind of strategic planning, we can make in very short periods of time extraordinary outcome improvements in terms of the results that we achieve for those that we serve.
And so, Hal, during this process, we've seen walls break down between health systems, that were competitors and now they're sharing information. Are you doing any of that with some of your peers, of sharing these best practices?
Absolutely. Again, very fortunate here in Columbus, because for roughly the past 2 decades, there's been this philosophy of the Columbus way. And the Columbus way speaks to how we can create partnerships across organizations, nonprofits, for-profit corporations, working together for the betterment of the community. This has been such a great story that it actually was a case study in the Harvard Business Review. So again, early in the pandemic, the leaders of the 4 major health systems across this region, including our children's hospital at Nationwide Children's Hospital, got together and said, this pandemic is going to challenge us in ways we can only begin to imagine. We saw what was going on in northern Italy, where those swabs were being made that you referenced earlier. And we saw what was going on in New York. And we said, let's not wait. Let's get together now and create a regionalized approach for addressing the pandemic. We did do that. On our own, we went to the city. We took over the Columbus Convention Center to create a surge hospital with 1,100 beds in it. We did this without FEMA coming in. We did this without waiting for the National Guard to come in. We did this on our own. We said it was the right thing to do. We went to the state and worked with the state to create a region-wide approach across all of Central and Southeast Ohio, which then tied in a total of 40 community hospitals into this process. Again, learning the lessons from other parts of the country and other parts of the world, and saying, let's make sure we can level set surges in the pandemic and put the right patient in the right bed at the right time. And if they need to come to a place like the Wexner Medical Center, which is a quaternary care academic health center, to get this rarefied care, ECMO, and the other things that we could offer, then let's do that. But let's make sure that we've aligned around capacity and around demand. And the good news is that using that approach, we never even had to use the convention center. And I've been asked, do you feel like you've wasted a lot of money in doing it? And I said, no, not at all. It's an insurance policy. All of us pay for insurance all the time, and we all hope we never have to use it. So now we've removed everything from the convention center. We have it, in storage somewhere, and we're hoping that we'll never, ever have to use it for that purpose. So we're looking forward to getting to the other side of the pandemic and getting back to what convention centers are supposed to be used for.
That's right. Yeah, absolutely. Hal, I did want to circle back on diversity, equity, those types of issues, social determinants. As you were laying out some of the things you've been doing to address the communities of color that have been hard hit during the pandemic, talk to me a little bit about what those lessons learned will mean for your focus on social determinants going forward.
Sure, absolutely. So, you know, we're starting from a really great place here at Ohio State Wexner Medical Center. We were ranked last year by Forbes as the fourth most diverse employer in the nation. That's not, I'm not talking about health centers, I'm talking about corporations. So Procter and Gamble, SAP were among the top four. We were ranked number 4. So we're starting out with incredible diversity. Our College of Medicine has an exceptionally diverse representation of students who are among the top in the nation in terms of African American medical students. And this has been something that has been developing over the past several years. We're all extraordinarily proud of that. But at the same time, we realize with that background, there is so much more that we have to do in front of us. There's so much that we can do. And this issue of health equity becomes extraordinarily important as we look at social determinants of health specifically. Early on in the pandemic, when the issues around structural racism really came to the surface, we decided that we had to do something about that. We thought it's important to do that for this broad geographic region, but we also thought it was exceptionally important to do that to be a national leader, to address this, and to really set the bar for the things that need to be done. So we set up our anti-racism action plan, which was an all campus-wide, academic health center campus-wide approach to addressing racism in the local community, looking at ways to address health equity in the local community. We saw enormous opportunities in what we could do. We have two communities here on the outskirts of Columbus. One is predominantly white, one is predominantly minority, African American. They're 1 mile apart, and the difference in life expectancy between those two communities is 18.3 years. So there are extraordinary opportunities to go into these underserved communities, minority communities, and really address determinants of health. We said early on that racism is a social determinant of health. There is ample evidence during this pandemic to support that. We all know that the mortality rate for Blacks is higher than whites with COVID-19. But when you look at age groups, so for example, the 45 to 55 age group, the mortality rate is significantly higher for Blacks than for whites because you've excluded the elderly from that analysis. And why is that? Well, there are many reasons. Many are the issues around work, overcrowding, a whole array of different issues. But we also know there's ample evidence to show that racism causes physiologic stress that leads to oxidative stress, that leads to other health conditions as well, cardiac disease, for example, poor wound healing, obesity. These are all things that are going to play a role in premature death. And on top of that, COVID, and you have a set of circumstances that we feel we have an enormous responsibility to address.
Yeah, those are, the dialogue that's happening around social determinants has been so amplified now, which is one of the probably silver linings that's occurred from the pandemic. There aren't many, but that might be one of them. Hal, in the last minute or two we have left, I did want to pivot a little bit. When we spoke, when you first came on in 2019, you had just gotten a federal grant to address some of the opioid crisis. And Wexner has been doing some other work on that front. I know you were doing some at CVS Aetna as well. We've seen a spike, obviously, in the opioid crisis during the pandemic. So can you talk a little bit about what you're seeing, and have we forgotten about what's going on in that other epidemic?
Right. Yes. So I don't think we've forgotten. I just think that like a solar eclipse, this pandemic has just blotted everything else out, and it is extraordinarily concerning. It's extraordinarily concerning. I think that what we have to do is focus on the work that has been going on for quite some time. As the pandemic recedes, and we're all extraordinarily optimistic that we'll see that sooner rather than later, but as it recedes, we're going to now see the impact, the additional impact in terms of social isolation, in terms of joblessness, in terms of financial impact, emotional toll, that will only be additive to the existing and underlying opioid epidemic in this country. And, you know, we were looking at somewhere in the neighborhood of 70 to 80,000 deaths a year due to opioid overdose, drug overdose in general. I'm exceptionally concerned, and there is evidence that this pandemic only exacerbates that. And that gets back to what I said earlier, why we have to work in the home, why healthcare begins in the home and in the local community. We know from other experience that that is the best way to address this epidemic, in addition to training and education, making sure that we've trained physicians and clinicians around how to address opioid addiction, medical assisted therapy, making sure that our physicians and nurse practitioners are trained and certified so that they can write scripts for medical assisted therapy, so that we have behavioral health programs and mental health programs to support those that are addicted and to get to some of the root causes of addictions in the local communities. One of the enormous responsibilities that we have here at Ohio State is that this is virtually the largest health science campus in the nation. We have 7 colleges, a very large school of health professions, a total of 10,000 students on this campus. We're getting educated each year in the health professions. So we're focusing on interprofessional education. And this year, the theme for our interprofessional educational program, which involves 1,300 of those 10,000 students, is in service learning around addiction, and following the work that we did last year, and looking at the impact of COVID and now racism. So it's a continuing theme. Last year was addiction. This year it was structural. This year it's structural racism as a social determinant of health. And as we bring these things together year after year, we believe we have an enormous opportunity to continue to engage in this process.
Well, Hal, those are some really positive things you're working on. We'd love to be able to check back in with you, see how they're unfolding, especially once we come out of this pandemic, hopefully spring, late summer, something like that. But thank you so much for taking some time today. We really appreciate it.
Appreciate the opportunity, Matt. Always great to see you. Thank you.
Thanks. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.